All right, so really exciting talk today that I have with Dr. Saumya Shah. We actually met Saumya a couple of years back when he was approaching the Matchpal team and he was interested in anesthesia. And I think he was looking for some help and guidance in the process. And, he's really enthusiastic about the field and eager about, matching. And we were very, very excited to help him. And then after, he absolutely crushed his match and matched at USC, he turned around basically immediately and was like, hey, I love what you guys are doing and I want to join. And obviously, he did a great job in his season. So we were very, very happy to onboard him. And he's just been a phenomenal asset and resource to students all over the country over the last couple of years and helping them in their journeys. So Dr. Shah, thank you for your time and welcome.
Yeah, thank you for having me.
Yeah, why don't you tell us a little bit about what made you choose anesthesia in the first place?
Yeah, so this goes back to, I think, what a lot of people have this same shared experience during med school, which is a lot of schools don't have a lot of exposure to anesthesia. So I was one of the many people who just stumbled into it. I was on my OBGYN rotation. I was able to be in the ORs and then kind of had this sense of curiosity of what's going on, all in the OR. So whether it was helping out on the C-section or talking behind the curtain with the anesthesiologist to see what's their approach to the patient's case. And then I started to realize slowly that I was liking a lot of the in-hospital type of medicine. So I kind of quickly realized I didn't want to do a clinic-based practice. I liked being in the hospital. And then slowly finding my favorite place in the hospital was the OR, the team dynamic that was involved with everyone from the circulating nurses, the scrub techs, the surgeons, the anesthesia providers. It was a nice team dynamic. And then taking it one step further with anesthesia specifically, it was one of the few specialties, at least for me in my experience, where you could actually make a real-time decision and act upon it, and you can kind of see the results right then and there. So being as fascinated by a patient's blood pressure starting to drop, and the anesthesiologist asked me, what do you want to do? Can't really sit there and start going through a whole differential and try to figure out what's going on. It's kind of look at the blood pressure, look at the heart rate, make your best guess, grab medication, administer it, then chart it, and then you think through about what's been going on, what happened. I thought the adrenaline rush of that decision making was very fun, very rewarding, and it's just a field that I was really drawn to.
I love that. And now that you are, kind of on the other side of it and getting your hands dirty, so to speak, how do you feel that decision is translated over? Do you like it more, about the same, maybe less? What's your take on anesthesia now? I think as med students, we can get very excited about things because we have a little bit of a naivety, which can be very helpful sometimes, but also can be a little bit misleading because you don't fully understand the full scope of the work because you don't just know enough at that point yet. So what's your take on it now?
Yeah, it's changed slightly. For my program specifically, it may be a little unique to a lot of the program's approaches for anesthesia, but our intern year is a general surgery intern year. So in a way, it's good and bad. It's good in the sense that I get to meet a lot of my surgery colleagues. A lot of my friends at this program now are surgery residents. I know a lot of the attendings. The bad side of it is that every reason why I chose anesthesia, I get to do all the opposite things, right? The rounding, the notes, but it's rewarding in the sense that I get to see the whole team approach to a patient's care, right? So there's a lot beyond a patient just coming into the OR, you putting them to sleep, giving them the meds, and then send them off. You get to really see what goes on post-op day 1, day 2, day 3, day 65 because of complication. This patient's still in the hospital. So the real world kind of experience with anesthesia has been a little more eye-opening for me. Coming into this new year as a CA1, I think I'm going to get a lot more experience and moments to do what I want to do. So I'm actually looking forward to this year a lot.
Awesome. Well, that brings us to understanding what it was like going into anesthesiology sub-internships when you were a med student, right? So, you decided to apply anesthesia, you had, your mentors from different avenues, and you kind of had the tools necessary to kind of lock in the rotations. How did you approach preparing for those rotations when you were about to start your first sub-internship?
Yeah, so my school unfortunately didn't have the infrastructure set up to help guide me with anesthesia rotations or a lot of rotations, to be honest. So really a lot of my learning came from YouTube. And I remember back then I would just look up how to be successful on a sub-I in anesthesiology. And I would go on YouTube, nothing. Google, nothing. I would try on Instagram, looking up, are there shorts or reels that I can look at? There was nothing available. And I think that's where Matchpal has really opened up the eye for me, where we can really help fill in these gaps. I've been there for so long. And I think a lot of my anesthesia colleagues say the same thing, which is in med school, it's really hard to get some good anesthesia exposure, some good training, and a lot of overview before your sub-I season. So this is a little bit why we came together for this course.
Exactly. Yeah, I think that the more niche the specialty is, the more challenging it is to find resources on it. It's really hard to walk in, you're going into this super high stakes environment. People are essentially evaluating you every minute that you're there, from when you start to when you finish. It's a month long. The hours can be grueling, and you don't know anyone when you start. And now you're expected to also perform at a level that makes them want to hire you for 4 years, which is a huge thing. And a lot of the times, like yourself, myself included, coming from an osteopathic school, we don't have the background. We don't have a name brand representing our school. We don't have the background of like the actual like experience as far as maybe the knowledge, the exposure, the technical stuff that we need to know. And now you're expected to somehow impress people. It's a really intimidating position to be in, right? And I think in order to address that, we were really racking our brains, and obviously providing one-on-one mentorship is amazing. And I think that meeting with someone who has just done the process a year or 2 or 3 ago and is a resident, is actively involved with sub-Is, kind of sees the full breadth of good, bad, and in between, you were able to provide that guidance. But we wanted something that was also more accessible and wasn't necessarily requiring you to interface with an advisor for an hour or 2 or 3, but rather something that you could do on your own time. You can learn really the in-depth nuances of the actual clinical knowledge of the specialty and use that to then go into your clinical rotation and actually be able to answer questions and understand what's going on and already have the basics out of the way, right? And so that's the whole impetus for why we created the Anesthesia Sub-Internship Bootcamp. I think it's definitely one of the fields that lacked a lot of the kind of resources. Tell me about how we structured the actual bootcamp itself. What's included for someone that may not be aware, might be interested in learning more about it?
So we really try to hype in on different learning styles for different people, right? I think a lot of us have had that experience where we're given one way to do or learn something, and the reality of it is it just does not work for everyone. So I think our approach was we made an audio version, right? So you can kind of plug this into your phone while you're driving on your way to the hospital. You can listen to a couple of minutes, jog some ideas, just learn by listening. There's a video component to it where you can follow along with the slides. If you're a visual learner and you like reading, that's one thing. That's something that didn't work for me. So for me, an auditory component was a huge aspect for this. And then the third, I think the third tool is that there's a lot of questions that we built in throughout. So whether it's in the slides or we have a PIMP section at the end where you can kind of go through common questions and I think we're doing our best to try to engage different learning styles for different people. If you find yourself stuck in traffic 20 minutes on your way to the hospital, your first sub-I, this is a perfect chance for you to just listen to the sub-I bootcamp video kind of in a podcast format so you can do some learning.
Exactly. And I think that as far as the breakdown of it, I think we really cover everything that a student could want to know, right? I mean, there's literally everything from setting up the anesthesia machine, which is something that I feel like nobody learns in medical school, like nobody even cares to teach it to you, all the way through to like pharmacology review of some of the medications that you may have learned for like step 1 or step 2, but maybe forgot by the time you actually go into your sub-I, or maybe you never knew them in depth as far as like dosing them and actual indications or contraindications for using them. And then of course, I think one of the biggest values is really having PIM questions on hand, being able to really understand what is most likely to be asked of you and know it in advance, and then you look like a rock star when somebody does end up asking you.
Let us be the reason why your cortisol goes up a little bit, Hear the question for the first time with us, and then when you're in the OR and your attending is asking you the same exact question, probably multiple times on different rotations, and you'll have an answer ready for them.
Absolutely. So when should students use this course? Like, what's the best time to actually implement it in the timeline? Let's say, you're a third year med student, it's June, you're maybe prepping for step 2. Where does the bootcamp come into play?
I really think this bootcamp can come into play at pretty much any time. I think the important part is before your first sub-I, your first audition rotation, just going through it once to get a big picture overview about, like everything you said, setting up your machine, setting up like your airway station, a lot of the common drugs, a lot of common questions that you'll be asked. And not that you have to memorize everything the first time, but at least just get exposed to it. And then you'll notice that after your first week or your first day, there's questions that keep coming up, or something that you saw that didn't really make sense. You can kind of go back to the videos, or even just go through some of the written format to kind of jog your memory on it. So I think it has a lot of utility throughout your sub-I season, but definitely the earlier you start, the better, the higher utility of this.
Yeah. And I think one thing that was really cool was putting together the case-based review at the end. So even after all the knowledge was presented, we basically compiled these 2 cases. One was like kind of a bread and butter case, routine, maybe an outpatient type of thing where you're able to plan your anesthetic plan the night before. You're able to kind of like pre-op your patient, almost like, if you took the name down and the MRN of your patient for the next day and you go home, like how do you think about setting up the plan for an elective procedure? And then we also did like a trauma case. How do you respond in the acute setting to a patient who really needs urgent attention? You don't really have the time to maybe plan things out as much. You really need to like stabilize someone who's in critical condition and let surgery essentially save them. And I think that's a really cool addition that we have as well for students to understand how the knowledge implements into actual clinical practice on the day-to-day.
And we're doing our best too. So anytime we hear feedback from anyone of things that they want added onto this course, we're really taking into it. So already in the works, we have kind of like a template that we want you to be able to just print out and take it to work with you when you're pre-oping your patients. It's something where you will see exactly what you need to know for this case and what information you should grab from the patient. And that way when you're presenting to your resident, to your attending, and kind of impress them with some of the knowledge or some of the pearls about that patient that you're giving.
Exactly. Constantly kind of iterating it, making sure that it's like the best resource out there. I love that. All right. Anything else that students should know about the course, anesthesia, your journey, any pearls, anything that you want people that are considering the specialty to walk away with today?
Yeah. So one thing, you talk about it in the course specifically, probably in a little more detail. Anesthesia is one of those specialties where it's very hard to leave a lasting impression on your attending in the room. You're going to notice that you'll probably spend more time with the resident in on that case, and the attending is going to kind of be in there in the beginning, maybe towards the end or in the middle when things are not really going right. But I think a big utility of this course is understanding the concept that even little things that you demonstrate on a day-to-day basis, as simple as putting in an IV, right, or going through a preoperative checklist and making sure your resident has everything that they need, small things will gain trust from your resident, from your attending, right? And each time they're going to allow you to do more things. And so I found that very useful during my sub-I time, which is when I first walked into an OR, new hospital, have no idea what's going on with the case, like what to expect. But if I can just kind of predict a little bit what my resident or my attending will need help with, that kind of demonstrates to them that you're at least aware of how the OR is working, how a general anesthesia kind of timeline goes, and it gains a sense of trust within you. So they'll allow you to do more things down the line.
Yeah, no, absolutely. I guess to round it out, we also added in a primer on all the anesthesia subspecialties so that people considering this field can actually understand what are the paths forward, meaning like after residency is done, do they want to do general? Do they want to subspecialize? What are the nuances of each of those fields? And I feel like that's another really, really cool extra feature. And then we also threw in a couple of videos on just like delivering value as a sub-I and kind of more theoretical components of standing out in your rotation that honestly apply to probably most sub-Is, not really necessarily anesthesia specific, but I feel like some incredible pearls on just things that you want to consider that may not be common sense that, you don't really realize until you're actually the one working with the student and evaluating them yourself. And I think those are really cool like add-ons in addition to all the things we talked about. So yeah, I really appreciate you coming on today to help raise awareness about what it is that we put together. And it's gonna be awesome for those using it. We already had a ton of engagement with it, and hopefully we get more people to utilize it this sub-I season, have some amazing success, get amazing letters and interviews and matches, and provide a lot of value to future anesthesiologists. So thanks, Dr. Shah. I appreciate it.
Yeah, of course. And anytime we have any updates with this course, we'll make sure that everyone's aware about it too. So you'll always have access to all the new things that are being added on.
All right, man. Take care.
Thank you.